Well, my friends, this is a serious case of dysphagia. খাবার গিলতে অসুবিধা হচ্ছে। খাবার খেতে কি অসুবিধা হচ্ছে?
গিলা যাচ্ছে না, বন্ধ হয়ে যাচ্ছে।
কষ্ট হচ্ছে, খাবার যাচ্ছে না,
যাচ্ছে না নিচে দিয়ে।
শক্ত খাবার যাচ্ছে না, নরম খাবার
ও লিকুইড জলের মতন হলে
খুব লিকুইড জলের মতন হলে তাও একটু যাচ্ছে, তা না হলে যাচ্ছে না। করুন দেখি। So this is called dysphagia. My friend, this is called dysphagia, খাবার গিলতে অসুবিধা। In medical science, in practice of medicine, in surgery, clinical surgery, this condition is known as dysphagia. Phagia means swallowing, gela. This means painful, অসুবিধা. Menstruation painful, dysmenorrhea. Coition painful, dyspareunia. So, dysphagia. Difficulty in swallowing. Difficulty in swallowing, called dysphagia. Now, what are the causes of dysphagia? এই ডিসপেজিয়া রোগীর চিকিৎসার জন্য আমাদের কাছে এসেছে। আমরা তো কেস চেকিং করেছি, ওষুধ দেবো। দি পেশেন্ট এজ অ্যাবাউট 65 years has come from Tripura state of India. The main complaint is dysphagia, খাবার গিলতে অসুবিধা। These may be temporary, these may be very acute due to insertion of any foreign body, fish bone, meat bone, and may give rise to dysphagia, which is often painful, and the cause is the symptoms are transient. Now it may be due to stricture, কিছু গ্রোথ হয়েছে, আটকে গেছে, তার জন্য হতে পারে। The growth may be of two types, benign and malignant. All the growths in anywhere in the body we may classify it into two groups, benign and malignant. Then there may be benign growth in the esophagus. Benign growth, this is the esophagus. The benign growth or benign stricture, it may cause due to reflux esophagitis. খাবার দাবার যখন উপরের দিকে চাপ দিয়ে উঠতে চাইছে, that is called reflux esophagitis. Often associated with a hiatus hernia. Reflux of gastric acid into the esophagus from the stomach causes recurrent inflammation and stricture in the esophagus, which develops some stricture, not malignant, benign growth, but also but presenting the symptoms of heartburn, acidity, and esophagitis is the pathological symptom. But there are other causes. Achalasia cardia is another cause. Dysphagia may develop as a result of disturbances of the nervous controls of the lower part of the esophagus, esophageal sphincter muscles. And this failure of relaxation of these sphincter muscles delays the passage of food into the stomach from the esophagus. And the esophagus very dilated. The lower part of the esophagus dilate করে দেয়, ফুলে যায়, খাবার নিচে নামতে পারছে না। This condition usually occurs in women aged about 30 to 40 years, and the dysphagia takes many years to develop and may be accompanied by symptoms of gastric reflux, I mean acidity, heartburn, pyrosis, water brush, and a severe retroesternal pain. স্টার্নামের ভিতরে বুকের ভিতরে মারাত্মক ব্যথা হয়, a severe retroesternal pain. In the later stages, vomiting may occur with aspiration of the contents of the esophagus into the lungs. ওখান থেকে খাবারের টুকরো উঠে রস উঠে লাংসে চলে যেতে পারে। অ্যাজ এ রেজাল্ট অ্যাসপিরেশন pneumonia may develop. So development of aspiration pneumonia, which is a very serious complication in the case of Achalasia cardia. Another cause, so I have told the benign cause, that means the stricture of the esophagus for dysphagia, খাবার গিলতে অসুবিধার জন্যে। I have told the achalasia of the cardia, the reflux mechanism from stomach to pressure gives upwards, pressure goes upwards, that is called achalasia cardia. Another cause is psychological cause or psychic cause. There is always feeling in our medicine sepia, this symptom is found, asafoetida, these symptoms are found, as if something ball is in the throat. গলায় যেন কিছু আটকে আছে। This is called esophagus খাদ্যনালীতে কিছু আটকে আছে। So acute anxiety often give rise to a sensation of difficulty in swallowing, as though there were a lump in the throat. These symptoms may persist and termed in the practice of medicine as globus hystericus. So there are different causes for difficulty of swallowing. These globus hystericus become obsessional so that neither fluid nor solid enters through the esophagus. So খাবার গিলতে অসুবিধা, the dysphagia may cause due to psychological. There is sensation of lump in the throat, which is known as globus hystericus. The cause may be benign growth, cancer নয়, benign growth হয়েছে, or that may cause due to Achalasia of the cardia, যখন ইসোফেগাসের নিচের পাটে চওড়া হয়ে যাচ্ছে, খাবার নামছে না, স্পিন্টার করছে না, খাবার রস অ্যাসিড সব উপরের দিকে উঠছে, that is called Achalasia cardia. So the main three causes are Achalasia cardia, psychic and benign growth. But number 4, the very dangerous culprit is the malignant growth. This gentle lady has been suffering from malignant growth, my friends. This is the treatment paper. She has already consulted with surgeons, MD medicine physicians, and they have diagnosed upper GI endoscopy done, and it has clearly mentioned esophageal growth malignant. There is malignant esophageal growth, and for confirmation they have done the biopsy, and the biopsy result shows suggestive of high grade dysplasia. So this is malignant growth. So the third cause of the dysphagia is malignant tumor, carcinoma. So the first cause is benign growth, the second cause is Achalasia cardia, third cause is globus hystericus or psychological, and the fourth cause is malignant, the dangerous culprit. So malignancy, carcinoma of the esophagus is not uncommon and usually occurs in the middle age. We have told that the globus hystericus found within 30 to 40 years, the carcinomatous growth comes under 50 to 60 years. This gentle lady having age 65 years. So the age is the factor. Malignancy generally comes after 50, 55 or 60 years. So the middle-aged person or elderly persons are the main sufferers or victims for carcinoma of esophagus. It causes a progressive dysphagia, first for solid food and then for liquids. প্রথম দিকে সলিড ফুড খেতে পারে না, লিকুইড খেতে পারত, যত দিন যায় আস্তে আস্তে লিকুইডও খেতে পারে না। এই ভদ্রমহিলা যেমন বললেন এখন খুব হালকা জলের মতন কিছু হলে খেতে পারেন, তার বেশি আর খেতে পারছে না। পেন মে অকার অন swallowing, but persistent pain implies local infiltration of the tumor. Weight loss and anorexia are common, and anemia and lymphadenopathy may also be found. Like other malignant conditions, anemia, cachexia, loss of weight, etc. are the common symptoms in esophageal carcinoma too. So, esophageal carcinoma, a very dangerous condition, একটি ভেরি সিভিয়ার কন্ডিশান, এবং পৃথিবীর অনেক কার্সিনোমা ম্যালিগন্যান্সি বা রোগের মধ্যে সব থেকে কষ্টকর হলো এটা, আমার চোখের সামনে খাবার সাজিয়ে দেওয়া হচ্ছে কিন্তু আমি খেতে পারছি না। ছেলে মেয়ে আত্মীয় স্বজন সবাই চাইছে, মা বাবা আত্মীয় স্বজন যেটা খেতে ভালোবাসে সেটা সাজিয়ে দিচ্ছে, মা তুমি খাও, বাবা তুমি খাও, কিন্তু খেতে সে পারছে না। তার থেকে কষ্ট বাড়ির লোকদের আরও বেশি। So, esophageal carcinoma, a history of progressive painless dysphagia. Please remember, শুধু সিমটম নেবো আর হোমিওপ্যাথিক ওষুধ দেবো আর বড় বড় কথা বলবো, আমি ভিতর কাছের ছাত্র, আমি এই শেখাচ্ছি, আমি ফেসবুকে ওই শেখাচ্ছি, আমি বড় মাস্টার, আমি বড় হনু। হোমিওপ্যাথ ডাক্তারদের মধ্যে এই জিনিস চলছে, কিন্তু জানে না কোনো প্র্যাকটিস অফ মেডিসিন, না আছে কোনো নলেজ অ্যাবাউট ডিজিজ ডায়াগনোসিস, ফলে তারা ম্যানেজমেন্ট করতে পারে না, প্রগনোসিস জানে না, রোগীকে, রোগীর বাড়ির লোকজনদেরকে, পার্টিকে কিছু বুঝিয়ে বলার ক্ষমতা রাখে না। So this is called dysphagia, my friends. There may be history of progressive painless dysphagia. তুমি দিনের পর দিন ওষুধ দিয়ে যাচ্ছ কিন্তু রোগ তুমি ডায়াগনোসিস করতে পারছো না। At first the dysphagia for solid foods, which is followed by very soon dysphagia for liquid foods also. And with the history of food bolus obstruction, weight loss becomes extreme day by day, and sometimes chest pain, and in the later stage hoarseness may develop like other malignant conditions, and especially in this case due to pressure of the left recurrent laryngeal nerve. So prognosis is very bad. This is the squamous cell carcinoma, and there is a high prevalence of quick death. There is a high prevalence. Weight loss is often extreme. Chest pains and hoarseness when develops, there is high prevalence. And despite all modern treatment, the overall survival period is very less, maximum 5 years. So this is called carcinoma of the esophagus. Carcinoma of the esophagus. Now, in homeopathy, we treat the patient, not the disease. May it be benign growth, may it be malignant growth. Our procedure, our system, our treatment mode, our philosophy, our doctrine is same. By totality of symptoms, corresponding the symptoms, by collection of symptoms on single simillimum medicine to be ruled out. Now this case, the patient is lean, thin, emaciated, there is craving for salt, there is involuntary urination, there is profuse thirst, there is irritable temperament, consolation aggravates, and very much sympathetic. So our medicines, we have already selected sodium chloride, and sodium chloride is the choice of medicine for this patient. But the patient disease itself is psychotic. There in the family history there is asthma. She had taken COVID injections, dog bite vaccines. So after sodium chloride, if necessary, we may prescribe, we may think of deoxydantales. So our first prescription is Natramur in 50 millisiemens scale of potencies, and deoxydantales should be think of, and it should be kept at your hand for future reference. So this is all about dysphagia, my friends. Painful swallowing. It may be due to benign cause, benign growth. It may due to dangerous malignant growth. It may due to psychotic, which is known as globus hystericus. It may due to Achalasia, cardia, but the dangerous culprit on the malignant carcinoma, which slowly, gradually, insidiously, totally stops the feeding of the patient, and day by day the patient goes to the black jaws of the dead. Let's see the result, how much improve we may expect from our sodium chloride. I shall share you, my friends, after 3 months of this case.